Illinois leaders pushed back today against cuts to Medicare and Medicaid just days before the programs turned 60.
President Lyndon B. Johnson signed the Social Security amendments into law in 1965 to help seniors and low-income families. But now, our state's treasurer says that promise is at risk.
I have a medication that I take that is $6,000 for 2 shots a month.
Cassandra Alexander Green says Medicaid is the only reason she can afford those shots. She lives on less than $900 a month and calls it her lifeline, a reality Illinois Treasurer Mike Frerick says he hears all the time.
They're stripping away health care from working families, from children, seniors, veterans, and people with disabilities. This is not hard. Government should not hurt people. Government should help people. Without health coverage, people will die.
Frerick was on a press call Thursday with leaders from other states ahead of Medicare and Medicaid's 60th anniversary. He says Trump's budget cuts would strip coverage from 330,000 Illinoisans and put 9 rural hospitals at risk of closing. Republicans defend the cuts as a way to boost economic control and what they call personal responsibility.
This bill really delivers on the rest of those promises to get this country back on track, to bring hope back to people who want to control their own destiny.
They should check their math. If they're really interested in fiscal responsibility, they wouldn't be adding more than $3.4 trillion to the national debt.
But Frerick says it is a false economy that will cost everyone more in the end.
If you have people showing up to hospitals, not paying their bills because they don't have access to health care, they're going to get sick. They're going to show up. It's going to be unreimbursed, uncompensated costs for hospitals. Those hospitals are going to pass that along to others.
The Congressional Budget Office says 12 million Americans could lose coverage over the next decade. For Green, that number isn't abstract. It's a matter of life and death.
Without being able to pay for my medications, I can go ahead and die.
It has been 3 weeks since these cuts became law, and state leaders are still working to answer your questions like which hospitals will scale back or close, how quickly will people start losing coverage, and what support, if any, will step in to fill the gap.